Om Swastiastu, Assalamualaikum, Salam Nama Budaya. My name is Amory, and I am the representative for my student group discussion B3. Today, me and my group will present about our student project topic, that is becoming a doctor during a pandemic era. Please enjoy.
Hello, my name is Satria Wedananta. Student identification number is 2002511-071. Today, I would like to give a preface to our student project that is about becoming a doctor in a pandemic era. So what's a pandemic? A pandemic is defined as a large-scale outbreak of an infectious disease that may greatly increase morbidity and mortality over a wide geographic area and can cause significant problems. Recently, a new pandemic, that is the COVID-19 pandemic, has emerged. The outbreak of COVID-19 was declared as a pandemic on March 11, 2020 by the World Health Organization. A month after the declaration of COVID-19 as a pandemic, global health systems showed unreadiness for such a pandemic, which resulted in several casualties of their healthcare workers. A latter circumstance stems from healthcare workers that are unequivocally exposed to increased risk of infection through direct contact with patients. So here's some facts. According to the Ministry of Health of Indonesia, there are only 309,100 hospital beds in Indonesia, with most of them being located on Java Island. On top of that, there are less than 6,000 intensive care unit beds nationwide.
My name is Chintami Gemma Masella, and my student identification number is 20-02-511-070. Today, I'm going to continue to introduce the background information regarding to our topic. Despite a plethora of cases that have increased rapidly in our beloved country, Indonesia, we must acknowledge that there is a shortage of protective gear for healthcare workers. Albeit the number seems much, and actually, Indonesia only had 2.7 ICU beds per 100,000 people. Thus, the country ranked among the lowest in Asia. Based on the previous facts, consequently, an unprecedented amount of COVID-19 related psychological stress across professional and personal domains manifests in healthcare workers. As a part of our healthcare systems, medical students are also at risk for this issue. According to a research, the prevalence of moderate and severe anxiety and depression symptoms are higher among medical students during this dreadful COVID-19 pandemic.
Hello, my name is Huliana Lim. My student ID number is 2002-511-080. So now I'd like to tell you about the objective of this student project is to make medical student, especially Udayana University medical student, to be able to explain current condition and the learning process in medical student in the pandemic era, and then analyze current condition and problems in medical education for preclinic and clinical students, such as obstacle in measurement of basic clinical skill target of medical student during the pandemic, and education system transformation from conventional learning like face-to-face with the lecturer and the peers to online learning like we do now, and then explain the medical doctor profession during the pandemic era. Next.
My name is Tyas Parahita Wirawan. My student ID is 2002-511-082. I would like to present the benefits of this student project. The benefit of exploring the challenges faced by both medical students and workers during pandemic is to improve student critical and analytical thinking, writing skills, and social skills. Next. This paper also brings public awareness of COVID-19 by knowing the reality of pandemic and hopefully can decrease the number of infected people.
Om Swastiastu. Hello everyone, my name is Nadya Zalfa Aqilah and my student identification number is 20025111079. And in this chance, I would like to present the problem formulation regarding our student project about becoming a doctor in pandemic era. The problem that we like to discuss in this project are the problems that medical students from first year students, pre-clinic state, and final year students face. The problem comes from the education curriculum, psychological tiredness, and adaptation process from a high school student to a college student. Moreover, we discuss medical profession condition, especially doctors' conditions, psychologically, mentally, and physically during the pandemic era. Then we discuss more about solution and beneficial impacts from the pandemic, such as the control of several infectious diseases that transmit the same way as COVID-19, and the use of telemedicine during the pandemic era as a solution, and of course, some resistance to use the method in Indonesia. Thank you.
My name is Irrene Carla Audithia Pranadiningrum with student identification number 2002511075. I will explain the condition of medical students in the pandemic era. Medical students are students who enrolled in a medical school. Medical students are trained to follow many courses of study, leading to a qualification as a doctor of medicine. Medical students are acquainted with the medical setting system in a controlled way during their academic program. The COVID-19 pandemic caused significant changes for medical students. Particular disruption is evident within the education sector, with policies mandating the closure of schools, universities, public libraries, and the limited access to alternative study spaces. This condition has forced many students into an unaccustomed learning environment. Medical students are forced to do online learning rather than the conventional learning methods as an intervention to prevent the spread of COVID-19. Although lecture-based teaching is easily transitioned to an online format, interactive small group sessions and clinical exposure are not easily replaced. There has been several changes to replace conventional learning online because the face-to-face learning pandemic cannot take place. Preclinical medical students have difficulties in the learning process in the form of obstacles in doing basic clinical skills. Clinical skills are needed by medical students to be able to come into contact with humans, so that training in these skills cannot be carried out easily online without proper demonstration and supervision.
Hello everyone, my name is Angelique Cynthia Caroline. My student identification number is 20025111068. Previously, my friend had presented about the problems that are faced by the earlier medical students. Now, to solve this problem, there is an alternative way and appropriate way of learning called blended learning or hybrid learning. What is a blended learning? Blended learning is a way of teaching that mixes face-to-face teaching strategies and online interaction collaboration. What are the benefits or advantages of this way of learning? There are bigger number of rich understudies, lower cost, and increased student discernment of accomplishing course.
Hello, today I will continue my group's presentation. But first, my name is Gede Ngurah Winata with student ID number 225111061. For this part, I will present topic about final year medical student in pandemic era. So, based on current situation, there is COVID-19 pandemic in the world. Also, encourage final year medical student in many colleges in the world. But what is final year medical student? Final year medical student is a phase when a medical student who still need doctor's advice and direction to do real doctor action. This must be underlined to patient by taking with health records, working in the lab, and documenting visit. Even in pandemic, patients with chronic condition needs ongoing care, and many of final year medical students need to practice and learn so they can finish their study. According to Association of American Medical Colleges, medical students are students, not employees. They are not yet MDs. This means that many of these tasks can be performed via telemedicine, so preference of infection transmission. But not all of aspects of medical study can be replaced in telemedicine. Aspects like in-person care to direct patient must be done in real action. This including clinical rotation. That are from my presentation. Thank you.
My name is Putu Artika Darma Yoga. My student identification number is 2002511084. So now I would like to explain about how is the condition of clinical rotations during the pandemic era. So before that, we have to know what is the definition of clinical rotation. So clinical rotations or clinical clerkships are learning experiences and practice-based facilities where students will have one-on-one patient interactions and application of clinical science. Students will have first experiences of patient care under supervision for acquiring information and determining the final treatment plan. Clerkship programs consist of bedside teaching, emergency settings, and surgery training that allow first-hand experience with patients. However, in this pandemic, clinical rotation has been disrupted for final year medical students. In America, the AAMC has instructed medical schools to suspend student clerkship for a minimum 2 weeks. Postponing clinical rotations will later impair clinical training experience. Based on research from Yasmin, that 20% of respondents thought this cancellation can make their specialty choice change. The main reason is the inability to explore each of specialties on clinical rotation of interest.
My name is Justin Amory. My student identification number is 2002-511-081. There are a lot of problems that medical workers face during the pandemic. For example, lack of PPE or personal protective equipment that could lead to higher risks of workers being infected by COVID-19. There are also a lot of negative stigmas surrounding the healthcare workers. Some of them even get kicked out from their rent or home, and they commonly have to self-isolate alone, away from their family. The spread of medical workers are also uneven, mostly centered in Java, that leaves other areas more vulnerable. Medical workers also have long work hours that could affect them physically and mentally. The Indonesian Doctors Association have stated that 115 doctors and 82 nurses have died as a result of COVID-19 infection. Currently, Indonesia has the highest death rates for medical workers of any country in the world.
Hello, my name is Violina with ID 2002511083. Now I will tell you guys about the beneficial impacts from COVID-19. The first one is reducing the transmission change. In China, they've reported that there was a decrease in positive numbers of influenza and other diseases that has the same transmission as COVID-19 due to social distancing, mask wearing, and hygiene keeping. There were a lot of screening for fever cases and close contacts confirmed cases, further reducing the transmission. There would be a positive impact on influenza and other infectious diseases that were transmitted the same way, control and transmission. The second one is significant growth of telemedicine. The first model is using a healthcare provider. Patients are examined through online appointment from their house, which gives some benefits to the social distancing, and patient is more comfortable to tell their problems since they are in their own room. The second model is the patient go to a local healthcare or local clinic, which provides online communication too. This method gives a healthcare provider more specific vital signs data like heartbeat rate. Next, support. This telemedicine support the healthcare workers to work again in distance and reducing the work hours of frontliner healthcare provider.
My name is Gusti Ayu Ika Frangipani Vedanti. My student identification number is 20025111064. Today, I'd like to tell you our conclusion in the student project. Pandemic is a worldwide spread of a new disease. In other words, pandemic is defined as an epidemic of infectious disease that has spread widely across a large region and affects a large number of people. COVID-19 pandemic has fundamentally transformed education at all levels in medical education, and medical education needs to adapt and continue running its life. Most students agree that they accepted the risk of being infected with COVID-19. The blended learning system was chosen as the best and the right solution to keep them learning. This system is considered effective because this approach plays a significant role in enhancing students' knowledge, skill, flexibility in learning teaching process. The application of telemedicine can be the alternative interaction, but cannot guarantee developing clinical skills for final year students. Due to this pandemic, there will be postponing clinical rotation, which will lead to an overload of clerkship students next year. Become a doctor in pandemic era is much harder than usual. Doctors have to face infection risks to save many people's lives. Besides of that, not a few of them have been expelled from their homes because of the social stigma that doctors have bigger chance to spread the virus. Despite of all the struggles, the advent and growth of telemedicine can be the bright side of this pandemic era. Telemedicine is a very useful system by providing a lot of convenience for patients. This system allows patients to stay at home while still being able to obtain medical services. These are our references to make this student project. That's all from us. We hope this presentation can give you some benefits.